Are you one of those parents who have to fight to brush their child's teeth in the morning and in the night before you go to bed? Welcome back to our channel and thank you once again for joining us in this another day in the life of living on Autistic Edge. I am Terry and Elaine, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on Autistic Edge. Dental care can be a real nightmare for kids on the autism spectrum. And as parents, we want to ensure that our kids have a good dental hygiene. But sometimes it can just be a daunting task. Now, one of the biggest difficulty for parents when they're trying to maintain a good dental hygiene is the issue of sensory sensitivities. Some kids can be overwhelmed by the sound of the toothbrush. Even typical kids can be very overwhelmed at times with the whole idea of teeth brushing, much less the ones on the autism spectrum. That is just double the trouble. Others might be sensitive to the taste of the toothpaste. Others might just be resistant to the brushing, and that can be a major hurdle. As a matter of fact, I think this is the biggest part for all of us, getting the brushing in. Those of us parents who know what I'm talking about, you will know about the morning fights and the nighttime fights. Now, guess what? This is one of the fights where we just have to put up with, because we can't allow the teeth them to damage any at all, because this can be a very expensive and also painful venture for the children if we don't take care of their dental hygiene. No, but as parents, the first thing I always say to our parents, try to be calm. I mean, most say it is a frustrated thing, because guess what? I have been there too. And that is why we are talking about it here, because we're sharing tips, right? We want you to have a better experience than what we have. We have overcome the hurdle now to some extent, not entirely out of the woods, but we are doing much, much better when it comes to the dental care. As parents, we need to be flexible, we need to be patient, and we need to have a little bit of creativity and to adapt to the child's unique needs. So here is what we can do. Have your child play around with the toothbrush on a daily basis for familiarity. Or make it a daily routine. You decide how many times per day you want to brush. Some persons will do 3, some do 2. And again, depends on the child, because sometimes you really can't bother if you go fight 3 times for the day. So you may want to do just the morning and the night routine. Using visual aids can be helpful, whether it be videos or pictures, right? Demonstrate the process. Help them to understand what is it that you are trying to do. Toothpaste is plenty. Some of the children have sensitivity issues to the toothpaste. They may not like the taste. There are many flavors and types on the market, so you can just play around with them, try to find, which one of them your child would be more and more easily adaptable to. When we started out with the bubblegum flavor, because we realized that that was less harsh than the mint and all of those other flavors. So we did the bubblegum flavor. Now, Alex didn't really have an issue with the bubble gum, but he has more issue with the toothbrush, because his sensitivity was around having the brush rubbing against his teeth. So that was where we had the major issue with Alexander. Pay attention to the type of brush that you use. So use sensory friendly toothbrushes, right? You have some that has the softer bristles, and they also have different textures. So you may want to play around with those to see which one suits your child best. There's no one size fits all, right? So remember, what works for my child may not necessarily work for your child. So we're giving you the idea. feel around with the toothbrush, by the different textures, by the different softness in terms of bristles, and see which one he likes more. And then you can work along with that one. We went through a series of brushes. So I remember at one point we bought the finger brush, and we're going to drop some links below to show you where you can find these brushes. And if you are having challenge, you can try out any one of them. At one point, we went through the finger brush. So he wouldn't allow us to put the brush in his mouth. What we had to do is to put that brush on our finger and then push in and then massage the gum, because it has some little raised area to the back of the brush. So we could use that to massage the gum, and then we could turn the other side to get under and brush the teeth. And we had quite a bit of fight with the finger brush as well, but it was easier at the time. All right. Now, I remember one day I got bitten. Now, when I got bitten, that was the last day I used the finger brush, because we say, all right, the finger brush now work out. All right. So we went on to using soft bristles. So we had to search around to find which were the softer ones. So the soft bristle wasn't working out. It wasn't doing enough of the job. You may find that if you go around here, you have to be quick with what you're doing. And remember, you have 3 sides to one area that you have to brush. Now, Alex just now work with me on that one. So then we went on and we did some investigation to see what other brushes they had on the market. We came up with this lovely one. This was a 3-sided brush. So we got the manual 3-sided brush. You have 2 types of 3-sided brush. You have the one that is just normal, and you also have the battery operated ones. Well, Alex did not like the vibration, because we had a battery operated toothbrush before, but he didn't like the vibration. So we bought the 3-sided one that was not battery operated. That one helped us out for a little while, and then we had to make sure that, of course, the bristles were soft. So the good thing about the battery operated, when you put that in and you get a push and a pull, you are getting all 3 sides of the teeth being cleaned at the same time. So that I find very useful. So that is something that you can try, and that is if your child will allow you to put anything in their mouth, because we know the fight that can go on. So we did the 3-sided one. The 3-sided one, it works for a while, and of course the 3-sided one can be a little bit bulky, but they have the heads now in different sizes. You have smaller heads, depending on your child. You have medium-sized heads, and of course you have the larger heads. So you will have to pay attention to what your child like and which one you think would be suitable for your child, depending on their size and the fight that you have to put up with and all of that. Alex is much older, so the very softer brittles that we use at his younger stage would not work at this stage. So our dentist had recommended the Philips Sonicare. This one is the one we currently use, and I will drop a link for these below if you really want to try them. Now, we have 2 types. This is the 4000 series. We had this one first, and what happened is this one it has 3 modes, but it is much softer in terms of vibration. The 5000 series, the vibration is more, it gives you a better clean, and it has a whitening option, that is if you're doing whitening, and it also has a gum care option. When you put it on that mode, it vibrates for you to clean the gum. Now, I really love this one, because this one is really doing a world of good for us now. Now, after much years of practice, we allow Alex to work with the toothbrush. We allow him to play with the toothbrush. We sing songs around the toothbrush. This is the way you brush your teeth, brush your teeth, brush your teeth. This is the way you brush your teeth all on a Sunday morning. He loves the song, and he will bounce along with the song. So find creative ways. We know that they are going to fight, but guess what? They can't fight forever, but this is something that has to be done. We know that it has to be done. All right. We also learned that there's a U-shaped one, where you can just push that one in, and I think it does the vibration too. They have the battery operated one. When you push it in, press, and it does the vibration, and it will get all the teeth clean at the same time. Now, the challenge with that one is if the child will allow you to push all that in their mouth at once. So some of them will adapt, some of them won't. So we have to find out which one work well. Now, for the vibration, for this one, the battery operated ones, I know that a lot of the kids may have issue with the vibration. But as we go, we have to just try out which one work, because for us we had issue with the vibration at an early stage, but we keep trying it. We allow him to play with it, we allow him to use it as toy and just work around with it, of course. And then we just put on a new head, and then we try it. At one point, all of us in the house, we bought battery operated toothbrush for everybody in the house. So therefore, when we all brush, Alex see us doing the brushing, and then he started warming up a little and a little and a little till now. Yeah, Alex is now good. The issue we have now is he still has a sensitivity to the front of his mouth. So he will allow you to brush all the other areas, but to the front, he still has a sensitivity issue. Now, this is where I have to be creative, because we still can't allow the teeth to get out of control in terms of dental hygiene. So what we have done, we have purchased a dental calculus remover, if you can see that. That's the picture. And we're going to drop a link for all of these equipment that we use. So this is what it looks like. It's battery operated. So it have multiple options: soft, normal, middle, strong, and super strong. Now it comes with the little head, and we have different heads. So this is removable. I'll drop a link below. You can always go to the link and look at the detail for it, right? So we use this for cleaning. Now, he doesn't like when you touch the teeth. That is when you get the vibration. No, he doesn't like this one, and we thought that this would have been the better one. So if we have any little issue now, if your child is one of the fighter, don't try this one, because you may hurt yourself and you may hurt the child, right? But we are trying to see how long we can stay out of the dental chair with Alex Xavier in terms of the best that we can give with the practicing exercise. So this one, when you press it, it lights up at the top. Good. So this is one option, but he doesn't like this one. So guess what? Just me alone use this one for the time being. Now I have the one that is not battery operated. So this is the one that is not battery operated. So it have the different ends, right? There are some that are very pointed. If your child is a real fighter, don't try those, because you don't want to stick them, you don't want to hurt them. But there is one particular one that we were able to hide this one behind a rag. So I would just cover it with the rag and just push the tip barely through. So he will allow me to wipe his tongue, wipe around, whether with one of our clean rags or one of our gauze. You can use gauze as well, right? That does the trick as well. So it will just stick a little bit of it. So this, it's not very sharp, right? So we would use that to just kind of clean up against the inner section. If we see any build-up, along the teeth, then we will just use it and just kind of scrape. Now, he has warmed up to this one. So of the entire kit that I have here, this is the only one he warms up to at the moment. Now, that is just beautiful for me, because first time, if I just take up the case, him gone. At one point, him hide the case from me. Hide it? Yeah, can't find it. But now, I leave them on the counter. I introduce them to him. We play around them. As him see them, him, create him little anxiety, and he leaves. But I didn't push it all on him at once. So as we go along, we clean every day. And what I do is, when I'm doing my routine of any little build-up I see, I'll just try to get rid of them immediately. So when I'm doing my routine, I allow him to come in the bathroom and see how I do my routine. And then after a while, him don't like it, don't like it. But eventually, I was able to try this one. So for now, I think it was just one end of this one that I'm using. Both of them is the same. Yeah, well, one is slant and one is one cut straight across and one of them cut strong slant. So it depends on the angle that you want with the teeth. So this one is my lifesaver at the moment in doing a little no digging, just to barely keep away all of those little build up where the brush can't reach or the brush may not do enough. Another thing that we do is we add charcoal toothpaste. Now, I find the charcoal toothpaste to be a beautiful helper. That's a life changer for me. This one has in tea tree oil and it also has in coconut oil. Now, I find that with the tea tree and the coconut oil, I get a nice cleaning and a brighter white and a brighter smile when I clean with that one. Now, that is what I use for my teeth. So I use it on his teeth as well. And the taste is a little bit bland. So when I use it afterwards, I still go back and brush with the regular toothpaste. So Alex Xavier is adapting and he's working with us. He still has a little anxiety. The days of fighting, though, is over. We don't have to fight anymore. But what he may do is he still have the anxiety. So you will find you start brush here and him step back here and you have to follow him up. But if I have to follow him around the bathroom, I follow him around the bathroom. And we are now getting a better experience when it comes to the dental hygiene. Don't be afraid to try new things and don't give up. With patience, love, and a little bit of creativity, we can make the teeth cleaning exercise a breeze. Once again, thank you so much for joining us in this another day in the life of living on Autistic Edge. Don't forget to check out our other videos for tips and tricks of how we parent on this journey. Don't forget to like, comment, share, and make sure you subscribe so the next time we put out another content, you will be notified.